patients. How do you do it? Welcome back to another episode of, you guessed it, Stronger Nurse Universe with your girl, Stronger Nurse. One of the most exciting part of our job is interacting with the patients. Yeah, I said that. Being a nurse often means having a literal front row seat in your patients' lives. And you get to watch their highs and their lowest of lows. You get to console them when things don't turn out well and celebrate them after every itty-bitty medical win. Sounds exciting, right? The life of a nurse? Yes! I get to do this every single day. You certainly wouldn't have signed up for this life if, at the very least, you didn't love people. But sadly, even if you have the magic people skills of Abraham Lincoln in his prime, there will always be that 1, 2, 3, 5, you can have a whole damn assignment of patients that you literally cannot please, no matter what you do. I'm sure you know exactly who I'm talking about. Miss Betty over there. In fact, you're probably thinking of him right now, Mr. Peter over there. Whether we like it or not, I don't like it. Difficult patients, well, it literally is a part of the job and you can't get away from it. So the question becomes, how do we manage these challenging patients? Well, Stronger Nurse is here to give you a couple of suggestions. Number 1, let them talk. Let them be a chatterbox. Let them take up all your time in the room. If they want to take 30 minutes to just talk about nonsense, do it. I guarantee you, I've been a nurse for 15 years. Let me tell you something. These people, that's all they want to do. They want somebody to listen to them. They are either extremely lonely or their families don't want to talk to them or put up with them. Their doctors ain't listened to them for a while. So now hold on a minute. Hold on a minute. You're probably asking, are you saying, Stronger Nurse, that I should let Mr. Peter and Miss Betty, them assholes from the second floor, just walk all over me and talk to me any kind of way and spit at me and kick at me? No, that is not what I mean. The point is that we often tend to escalate our encounters with these problematic patients because we are always in a hurry. And I get that. That's just a part of the job. So we need to double down on their ideas instead of ours. It may surprise you, shocking I know, to learn that Miss Betty and Mr. Peter, they are not Grinches at all. They just really want to be heard. That's it. Before you put your walls up, your boundaries, and get all super defensive and come out with, words and just like, I'm not taking it. You need to be able to see it from your patient's perspective first. Because honestly, it's their experience. Your 8 to 12 hours of that little experience that they got. Number 2, you need to watch your nonverbal communication. I'd like you to be honest with me here. Put your hands up, actually leave a comment in the comment box if you know one person you think doesn't like you even though you've never spoken to them. Never said a word. See what I mean? Your body language, it says everything. And it can make your patients literally defensive as soon as you step in the room and they feel the need to attack you. So you need to try and avoid gestures and vocal inflections that make your patients feel like they're a burden, even if they are. Okay? You need to make it sound like they're not. I'm pretty sure that your relationship with your patients in the hospital or the clinic will significantly improve if you can only learn to smile and make them feel comfortable through your body language. You don't want to do this. 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 You don't want to do this, right? You don't want to do this. You want to look at them, listen to them, speak to them, connect with them, and have conversations. Number 3, go an extra mile, maybe getting them graham crackers and apple juice at 2 o'clock in the morning, getting them an extra thing of toothpaste, getting them 5 urinals, whatever it is. This one is a real clincher. Learn to treat your patients like they are more than just a chart that you need to chart. Listen to them and pay attention to the tiniest details about them. Their lives are so important because this is their experience. And even the most irritable, grouchy, grumpy, cantankerous patient will become so much friendlier if you remember their pet's name, if they have one, or their favorite show and put it on TV every time you come to work. Let your patients know that you care about them, and they often will reciprocate that gesture with kindness and sometimes really good conversation. Quick question, and this is to everybody in the community that's listening. What other ways do you think nurses can deal with challenging patients? Please, I'd love for you to share them in the comments, because there are going to be baby nurses, new graduate nurses that have never experienced a challenging patient. So they need the information from us experienced nurses to help them. We as nurses face a lot of challenges in the workplace. It's unending, and difficult patients are unfortunately a part of it. Fortunately, you don't need to deal with these issues alone. I'd like to introduce you to, you guessed it, Stronger Nurse Network, a growing community of thriving nurses seeking to build their careers, their finances, their relationships, and, you see it, emotional health. In the Stronger Nurse community, we ensure that each member lives a wholesome life. If you got an OnlyFans account, I don't want to know. So, we would like to invite you to go on this Stronger Nurse journey with us. So, join Stronger Nurse Network today and become the nurse you know you were meant to be by learning how to deal with these difficult ass patients. Thank you for tuning in to Stronger Nurse Universe with your girl, Stronger Nurse. I truly appreciate you turning in. I am grateful. Go ahead and hit that subscribe button. Yes. Thank you. I'll see y'all in my next video. Bye.